Hey guys, it's Kristen from Action Potential, and this video is going to show the top 5 exercises for healthy aging. Certainly, as you're getting older, we want to make sure we're taking care of the muscles and bones in our body to prevent things like osteoporosis or any kind of postural problems, as well as the risk for falls. So these are my 5 favorite exercises to help maintain good flexibility and strength, as well as one special one for balance. So the first exercise is going to be a calf stretch. To do that, you're going to come right up against a wall and step back into a lunge position. The idea is that the back leg is perfectly straight and your trunk is upright, not hunched forward. This is going to give you both a stretch in the back of the calf as well as a tiny little bit of a stretch in the front of your hip to help with upright posture. It's really important to hold this stretch for a good 30 seconds, upwards of a minute, so that you feel that nice long stretch in the back part of your calf. The calf muscles are incredibly important for helping to maintain balance as well as walking safety. So we want to keep those muscles nice and limber, especially as we age. You can see here I've switched over and done both sides so that I have definite flexibility benefits on both parts. The second one is going to be a pec stretch, which is the muscle across the front part of your chest. You can do this by putting your arm up on a door jamb and rotating away from the arm so that you feel that nice stretch through the front part of the pectoralis or chest wall muscle. This stretch is going to help combat that necessary or that tendency of hunching over as we age. Especially with things like tablet and computer use, we tend to want to hunch over throughout the day, and that can perpetuate with normal aging. So again, just putting that arm up on a door jamb and stretching away will help to open up the chest. If you're in a true door jamb, you can put both arms on and stretch forward so that you feel the stretch in both muscles at the same time. Otherwise, after a 30 to 60 second stretch on one side, you'll then rotate and do the same thing on the opposite side. The third exercise is actually my favorite exercise of all time. This is a squat. In order to do that, you're going to put your feet a comfortable distance apart and you're going to bend as if you were sitting down into a chair. So you're sending the rear end back behind you. Just a special note as you're doing this, particularly for the women, make sure as you come down into that squat position, the knees stay apart. They don't pinch together in the middle. We want to make sure they're nice and wide so that the hips are getting the muscle activity necessary to protect against things like a fall. The next exercise is a row. And for a row, you're going to take your arms, you're going to pull back and squeeze your shoulder blades together. This is really important for strengthening the muscles between the shoulder blades and the spine to help encourage a nice, strong, upright posture. It's going to help to also support the rib cage for adequate breathing, as well as to keep your body from experiencing back pain. You can add a resistance band by looping it over a doorknob or a banister and pulling that band towards you, or you can hold on to some weights or cans of soup and row those weights up by pulling the shoulder blades back onto the spine. And then the fifth exercise, this is for balance. What you're going to do is make sure you have a good spot where you can hold on for safety. You're going to stand up as tall as you can through one leg and then lift the opposite leg up off the ground. Once you're in this position, you're continuing to press yourself tall to the ceiling, and then you're going to go to one finger or maybe a float where you're just allowing that hand to come on and off the surface as you maintain your balance. As we continue to age, our body loses its ability to maintain that single limb stance. So I like to educate my patients that if you're between the ages of 60 and 70, you should be able to hold that position for a good 30 seconds before having to hold on. If you are 70 and older, you're going to want to make sure you can hold that for upwards of 10 seconds. If for some reason you're not able to meet either of those thresholds for your given age, then you would want to seek balance therapy to help prevent you from having a fall. So there it is, top 5 exercises for healthy aging. It's not quite the fountain of youth, but it's pretty darn close. Thanks and best of luck.